Hi, good morning everyone. I'm Justin from surgery in Dameron Hospital. So today I'm going to be talking about temperature and humidity. So it's just going to be a very quick summary of all about temperature and humidity and all the values. And I'm going to be talking about it based on the perioperative setting as per AORN standards. Okay. So I'm guessing you're all familiar with already the values and everything, but I'm just going to clarify everything. So we're gonna start off with the ranges. So for the ranges for the temperature, it's gonna be 68 to 75 degrees Fahrenheit, and for the humidity, it's gonna be 20 to 60% relative humidity. So we always want a temperature of 68 to 75. The implications for that, if it's lower, it's gonna have patient hypothermia. The staff will have discomfort, will be like a little bit cold, and there's also a risk for condensation. So for the condensation, colder temps may interact with humidity, creating condensation, impacting sterile fields and equipment. So we don't want that to happen. And also for higher temperature, it'll also impact the electric equipments. It'll cause sparks, or let's say the patient will also have hyperthermia, which is also a risk for SSI or surgical site infections. So we don't want that as well. So we always try to stay within the ranges. As well, same concept with the humidity. It has to be 20 to 60%, no less, no greater. So just a while ago, I was checking room 6 and called the engineering to make sure that it is within the range, because last time we checked, it was like 64, 65. So I called the engineering. I forgot his name. Andrew. So I made sure because this is a 730 case with a leg raise, so we made sure that the humidity is within range. So I did that as well. So yeah, so patient safety first. So make sure the supplies, if we see anything that's contaminated or affected with the condensation, it'll have like a big cost for the hospital to discard all the supplies, but safety first. And also the equipment, we need to re-sterilize it, reprocess it. And yeah, staff comfort, everything is, the temperature is good within range. So what do we do when this happens? So I'm gonna go over the things. This is simple, summary of what we do. We notify first. We call, notify the OR manager, or in this sense, in our area here, we call the engineering, and make sure that everything is within range. We inspect the supplies, we discard all those that are affected and reprocess them, and yeah, prioritize safety. So for cases that are emergent, we always use the unaffected supplies for the emergency cases. So the elective cases or the scheduled ones, we can reschedule that on the later. We always prioritize the emergency ones first. So yeah, basically everything is here.
Justin, what's the sheet?
Yeah, sorry. This sheet right here is every morning, every day, early in the morning before we start any cases, we always make sure to log this, all the temperature and humidity here. So here it says temperature, and if it's in range, we make sure it's documented here, the humidity as well, and then the room pressure. So it's either going to be positive pressure or negative pressure. So for positive pressure, it's generalized here. Only for negative pressure, that's like sometimes we use that for patients that have like pathogens, or like patients that have tuberculosis, something like that, but I'm not sure. So yeah. So yeah, generalized positive pressure, so we still log that here, put your initials, and that happens early in the morning before we open anything, any sterile packs. So yeah, that we have to log this each and every room from OR1 to OR6, because this, when Jacob comes or whoever is gonna check, they're gonna inspect that as well. So it's better to know that too. So lastly, to end this presentation, if you think it's too hot, too cold, too wet, too dry, stop, check, and report, and make sure we comply. So if you have any questions, feel free to ask. I'll answer to the best of my abilities.